And if we could begin by having you state your full name, spelling each of your names.
My full name is Andrew Michael Baker, Andrew Michael Baker.
Mr. Blackwell.
Thank you, Your Honor. Good afternoon, Dr. Baker.
Good afternoon.
You know, first of all, you conducted the autopsy on Mr. George Floyd.
I did.
Before we get into the specifics of the autopsy, why don't we explore your background a bit? You're the Chief Hennepin County Medical Examiner,
That's correct.
and would you tell us what it means to be the Chief Medical Examiner in Hennepin County?
So I've been the Chief Medical Examiner for Hennepin County since 2004. I'm actually the Chief Medical Examiner for Hennepin, Dakota, and Scott counties. My office provides service to all three of those counties, which is about 1.85 million Minnesotans, or about a third of the state, falls within our catchment area. Being the Chief Medical Examiner means that I supervise the rest of the staff, in particular my other physicians. I have 6 other doctors as well as a doctor in training that work under me.
And so before becoming the chief, you were the assistant chief,
Correct.
and that was in roughly 2002.
Correct. I was the Assistant Chief Medical Examiner for 2 years.
So all in, it's been going on 19 years as either assistant chief or the chief.
Correct.
What did you do before joining the Hennepin County Medical Examiner's Office?
Are you asking me to go back to my educational background or just my postgraduate training?
Maybe to the Air Force. To the Air Force?
Oh, prior to coming to Hennepin County from 1998 to 2002, I was a major on active duty in the United States Air Force. I served as a forensic pathologist for the Department of Defense. Our unit was known as the Armed Forces Medical Examiner, and at that time we were headquartered in the Washington, D.C. area.
Are you board certified in any areas?
I am.
Would you tell us which ones?
I am board certified in anatomic and clinical pathology, and I hold subspecialty certification in forensic pathology.
Doctor, would you tell us what the National Association of Medical Examiners is?
Yes, the National Association of Medical Examiners is the professional organization for people who do what I do for a living. I want to say we have about 800 or 900 members. Many of those are fellows like me, meaning they're fully board certified forensic pathologists. We do have a variety of other membership categories as well, for investigators, for administrative personnel, and for other support personnel in the profession.
Now, you are former president of the National Association of Medical Examiners.
Yes, I am.
In fact, at least as of to date, you're the youngest president, or were the youngest president ever to hold that position with the NAME.
I don't actually know that that's true, but I will take your word for it, Counselor. I did not know that.
Yeah, I thought I was just listening to you, Dr. Baker. So, but in any event, you have been the president of NAME.
Yes, I have.
So let's move now to the specific autopsy of Mr. Floyd. Could you give us some sense of what you knew about the circumstances surrounding his death before you started your work on Mr. Floyd?
Yes, so I was aware that Mr. Floyd had become unconscious while in police custody, that he had been transported to Hennepin Healthcare, and that was where he was pronounced dead. I believe at the time I started the examination, my staff was probably still working to confirm Mr. Floyd's identity and properly notify his next of kin. But that was basically the background information that I had.
Had you seen any of the videos at the time you started your work?
I had not. I was aware that at least one video had gone viral on the internet, but I intentionally chose not to look at that until I had examined Mr. Floyd. I did not want to bias my exam by going in with any preconceived notions that might lead me down one pathway or another.
So it was then several days after you'd done your work on the autopsy that you saw the videos?
One video I saw shortly after the autopsy, and that was the one that I think most of the public had seen through Facebook or other social media. The other videos, such as the cup surveillance video and the body-worn camera videos, I did not see until 3 or 4 days after the autopsy.
Could you, Dr. Baker, give us an overview of how it is you conduct autopsies? What's your approach to them?
Sure. So in a case that's believed to be a homicide or a potential homicide, there's a few more steps involved than a typical natural death or an accidental death. We start every exam with a very thorough external examination of the decedent's body in an as-is condition, meaning the medical devices are still in place. If the decedent came in with clothing, that clothing would still be in place on their body. All of those things potentially could be evidence to us as the medical examiners. In many cases, we will also collect trace evidence. For example, if the decedent's fingernails are long enough, we will collect fingernail clippings. We will collect some pulled head hairs as exemplars in case those are needed to match to anything. It wouldn't apply in Mr. Floyd's case, but in other circumstances, we shoot a fair number of x-rays before the autopsy starts if we're looking for things like bullets or stab wounds, broken knife tips, that sort of thing. Once all of those are done, then we very carefully set the clothing aside. We very carefully remove the medical devices, and then we examine the body again from head to toe, front and back. We're documenting this with copious photographs as we go. And then the final step in the external examination is we clean the body very, very thoroughly, because we don't want any blood, any foreign material, any plant material, anything that might be on the body to obscure the injuries or diseases that we're looking for. And then we, again, photograph the body head to toe, front and back. Once that part of the exam is done, then we proceed to the internal exam, which is, I think, what most lay people would think of when they hear the word autopsy. We make a set of very careful incisions on the body that allow us to remove all of the organs one by one, so we can look for evidence of natural disease, internal evidence of injury, and while we're doing that, we're collecting specimens for toxicology. Typically, blood and urine are the ideal specimens. We do remove all of the organs from the tip of the tongue to the bladder. We also remove the brain. We also remove all of the structures from the front of the neck, looking for any injury or evidence of disease. In a case like Mr. Floyd's, there are some additional steps we will take that wouldn't occur in most autopsies. So, for example, in Mr. Floyd's case, I did make incisions of his wrists and dissect around the skin underneath to look for evidence of what we would call subcutaneous bruising, or bruising under the skin from the handcuffs that were applied.
Overruled.
Please continue.
And then the last thing that I was going to say is also in Mr. Floyd's case, I did make a special incision from the back of his head all the way down to his buttocks, and I dissected underneath his skin all the way out to the sides of his neck, all the way out to his shoulders, and all the way out to his flanks. And you might ask why we would do something like that, and the answer is because sometimes fresh bruises can be difficult to see in some people, and so we look underneath the skin to make sure that we haven't missed something. Again, those last few steps wouldn't be part of a typical autopsy, but in circumstances like this, it's a generally accepted practice that we do that.
And Dr. Baker, is the autopsy part of a broader death investigation?
Yes, the autopsy is just one piece of the medical examiner's death investigation.
And could you generally characterize the umbrella? What's the death investigation entail overall?
So the medical examiner's ultimate mission, in addition to properly identifying people, is to ascertain their cause of death and their manner of death. The autopsy is just one component of that. It obviously has a great deal to do to inform the cause of death and manner of death, but we also need to know the decedent's past medical history. We need to get a hold of the decedent's next of kin to see if the decedent could potentially be a donor. If there's any family history that we need to know about, we will typically contact decedent's primary care physicians as well as get their hospital records. If an ambulance was dispatched and took them to the hospital, we'll even get the ambulance run sheet as part of our investigation. Because to get the cause and manner of death right, you need to assemble all of those things for the whole picture.
So let's go back to the autopsy aspect of it. How important is it to have a detailed documentation of what you do?
In terms of the autopsy?
Yes, sir.
Well, it's critically important that the autopsy be very detailed, particularly if the death is potentially a homicide, because obviously it could end up in a court and the work that you're doing would be evidence.
And do you create what we might refer to as a robust data set documenting what you do?
Yes.
What's all included in that?
So when I use the term robust data set, what I really mean is I have dictated the most detailed autopsy report that I can, describing all the scars, all the tattoos, all the birthmarks, all the injuries. In many cases, it's the pertinent negatives, meaning the lack of injury, places where you might expect to see an injury but you don't. All of those things are very carefully dictated in a narrative autopsy report. But that's not enough. You have to take copious photography as well. My goal is to create a set of photos that's so robust that another pathologist could take my set of photos and almost feel like they'd been there for the autopsy. That person has enough data that they could look at my work and reach their own conclusions. They don't have to take my word for it because it's in the photos.
And in the case of Mr. George Floyd, that's what you did?
That was certainly my goal, yes.
Your Honor, at this point, I'm going to ask Dr. Baker to identify the photographs from the autopsy. I still have them here in hard copy. May I approach Dr. Baker, Your Honor? Dr. Baker, I've handed you a number of photographs that should have exhibit numbers 186, 235, 185, 236, 187, 188, 189, 190, 191, and 192. I'll represent to you, that's what you have.
Okay.
And if you could just look through the set and just confirm for the record that those are photographs that you took during your autopsy of Mr. George Floyd.
So these are, in fact, autopsy photographs of Mr. Floyd, and they were taken by me.
Thank you, Dr. Baker. I'd like to redistribute them to the jury, Your Honor. All right. So, Dr. Baker, let me just ask you generally first about documented injuries that you saw with respect to Mr. George Floyd, and I'll ask you about specific parts of the body.
Okay.
Did you note any injuries to Mr. Floyd's back?
I did not.
Didn't see any bruises, scrapes, etc.?
Correct.
What about injuries to Mr. Floyd's face?
Yes, Mr. Floyd had several injuries to his face.
And if you could, Dr. Baker, look at Exhibit 186 and Exhibit 235. Now, I'll represent to you that the jurors have seen these two photos, but first tell us what do we see in these two photos?
These are photographs of the left side of Mr. Floyd's face. This would be after I have removed or cut away any medical intervention. Had there been any blood or foreign material on his body, it was cleaned up before these photographs were taken as well. And these were specifically taken to illustrate the injuries that you see on the corner of his left eyebrow and on his left cheek. You can see the bruising and the abrasion. That's fancy medical lingo for the big scrape on the left side of his forehead. And you can see the scrape or the abrasion on the left side of his cheek. It's very common for abrasions post-mortem to take on that dark black color. After death, the moisture that would be in an abrasion on you or me isn't there anymore, and so they tend to dry out and look a little bit more like this. That's what you see in the photo.
Mm-hmm. Do you have an opinion as to how Mr. Floyd would have incurred these abrasions?
Well, these would be entirely consistent with the left side of his face being pinned against the asphalt or the road surface that he was on the night before.
In the prone position?
Correct.
If you would, Dr. Baker, look at Exhibit 185.
Got it.
All right. What do we see in Exhibit 185?
This is an overall photograph of Mr. Floyd's face, taken early on in the postmortem examination. You can see the scale there in the photograph. That's actually in all the photos you have with his case number, and the scale allows you to gauge the size of what you're looking at. This is a photograph I would take in any case so that you can put a face with the decedent's name and the decedent's case number. You can see the injuries that we illustrated in the previous two photos there on the left side of his head and on his left cheek. You can also see a small abrasion on the left side of his forehead. It's kind of that pinpoint thing about an inch above his left eyebrow. You can see a laceration, which is a tearing of the skin on the right side of his upper lip. There's also some subtle bruising of his nose and a couple of small abrasions on the right side of his nose. And I think you can see a few small abrasions under the left corner of his mouth.
And Dr. Baker, what is the tube that we see in his mouth?
The tube in Mr. Floyd's mouth is the endotracheal tube that was put in during the attempt to resuscitate him. We do leave those tubes in place and cut them off before we start the autopsy. That's some quality control that we do for the hospital and the paramedics so that we can confirm the tube was in the right place when we do our exams.
So Dr. Baker, if you would go to Exhibit 187. What do we see in Exhibit 187?
This is a close-up photograph of Mr. Floyd's right shoulder. Centered in the photograph just above the scale, you can see what I would call an abraded contusion, which is a fancy medical lingo for a bruise that has some scraping superimposed on it.
And Exhibit 188?
Exhibit 188 is a close-up photograph of Mr. Floyd's left shoulder. You can see occupying most of the photograph there is an abrasion, the deep red and slightly less red and pink injury that you see. Again, it looks darker than you might envision this on yourself. Typically these will dry out after death, and that's why it takes that darker appearance.
And is this an injury that is consistent with Mr. Floyd laying prone on asphalt?
Yes.
And let's look at Exhibits 189 and 190. What do we see in Exhibits 189 and 190?
Exhibit 189 is a photograph of the back side of Mr. Floyd's left hand. Exhibit number 190 is a photograph of the back side of Mr. Floyd's right hand. In any case that we think has the potential to be a homicide, we do examine the hands very carefully and we photograph the hands very carefully. Our hands are largely the way that we interact with the world around us, and so injuries on the hands, or sometimes lack thereof, can tell us something about what happened. Specifically in Mr. Floyd's case, you can see a number of scar-like areas on his knuckles on the left and some scattered across the back of his right hand. I don't specifically know what those are from. Those obviously predate the events of his death, and I don't know where those came from. The more acute injuries that you see in the photograph, right above the scale in each picture, you can see kind of a patterned bruise. It almost looks like a tram track, those parallel marks. That's pretty typical for what handcuff marks look like when we see them at autopsy.
And Dr. Baker, Exhibit 191.
Exhibit number 191 is a close-up photograph of the back of the index and third fingers of Mr. Floyd's right hand. You can see that he's got some injuries over his knuckles. Just for orientation, if I were to use my own right hand, we're looking at an injury right here and an injury right here on the back of those two fingers.
And did you have an opinion as to what may be the cause of those injuries?
So these are blunt force injuries. These are abrasions and lacerations. Again, that's damage to the skin from blunt trauma. These would be entirely consistent with him having been in an altercation with another person. They certainly could be from the asphalt or just about anything his hand could have banged into.
Right. Thank you, Dr. Baker, and we can put the photos away. Now, I'd like to talk with you for just a moment about your examination of Mr. Floyd's heart.
Okay.
Did you take a photograph of Mr. Floyd's heart still intact?
No, I did not.
Would you tell the jury why not?
I don't normally photograph organs that appear to be perfectly normal unless there's some reason to. I don't have a photograph of Mr. Floyd's spleen or Mr. Floyd's liver either because those were also grossly normal. His heart was enlarged by weight, but that wouldn't really be something you could capture in a photograph unless it were so excessively enlarged that it would be obvious from the picture.
And so when we talk about the tissues of the heart, are you able to describe them generally, such as the endocardium, the myocardium, etc.?
Sure.
Would you tell the jurors what those are that you ordinarily look at?
Yeah, so dissecting the heart is one of the most important things we do in every autopsy because the heart is involved in so many of the deaths that we investigate. So the first thing we do is we carefully remove the heart from the lungs. The next thing you do is you carefully make sure that there's no blood or clot left in the heart because you want to get a very accurate weight. It turns out that the weight of the heart is a very good predictor as to whether that heart is normal or not. People who have high blood pressure for a long period of time, their heart will actually get heavier, just like any muscle that's worked hard. The heart will grow in response to that kind of stress. So we do weigh the heart first. The next thing you typically do is you very carefully dissect the coronary arteries. And when I say carefully dissect, I mean you take a scalpel blade and you cut every 2, 3, 4 millimeters in very fine slices along every one of the coronary arteries. A normal adult heart will generally be described as having 2 coronary arteries, the left and the right. The left immediately branches into the left anterior descending and the left circumflex. So we dissect those 2 very carefully. And then we look at the right coronary artery. So usually you'll hear people describe 3 coronary arteries, the circumflex, the left anterior, descending, and the right. So we want to make sure those arteries are in the right place. We want to make sure they have normal openings where they connect to the aorta. And then we go tiny slice by tiny slice, making sure that none of those arteries have narrowings or blockages in them. After we've done that, then we typically will carefully slice the heart, meaning the whole organ where we're now cutting through the muscle. And as you're making those slices, what you're looking for is evidence of previous heart damage. Is there a scar in the heart? Is there hemorrhage in the heart, suggesting maybe a more recent heart attack, if you will? There's many more rare conditions of the heart that we're also looking for while we do this. None of those apply in Mr. Floyd's case, but those are always in the back of our minds as we do this. And then the last thing we do is once we've cut through the muscle of the heart, we open all the valves of the heart generally in the same direction the blood flows. We make sure the valve leaflets are normal, make sure there's no infections, there's no calcifications, there's the normal number of leaflets. So yeah, we've now looked at the outside of the heart, the coronaries, the muscle of the heart, and the valves.
So having done all of that with respect to Mr. Floyd, did you find any previous damage to his heart muscle?
No, Mr. Floyd had no visible or microscopic previous damage to his heart muscle.
You know, and I apologize to you, Dr. Baker, and the jury, but there is one other photograph I do want to look at.
Okay.
So if we could pull out just number 192, which should be the heart valves. So, Dr. Baker, would you tell us what we see in Exhibit 192?
Yes, Exhibit 192 is cross-sections of what I would describe as the worst or the narrowest lesions that I found in Mr. Floyd's coronary arteries. So above about the 3 mark on the ruler, you can see 3 pieces of coronary artery that are fairly close together. The uppermost one in your photograph is what we would call the proximal left anterior descending coronary artery. So that means that's pretty close to the aorta, that's close to the origin of the artery. And in most adults, the left anterior descending is the largest of the 3 coronary arteries. So in this picture, you can see that Mr. Floyd's left anterior descending artery is quite narrowed. I would put that at 75% narrowing. The cut that you see right below that, which is the middle of the 3, that's another section through Mr. Floyd's left anterior descending coronary artery. So you can see that that area of very tight narrowing is still there. Again, I would put that at about 75%. And then the third one you see in that series of three, the one closest to the ruler, is the first branch off of his left anterior descending coronary artery. That's called the first diagonal branch. That can be a big one in some people. It was pretty good sized in Mr. Floyd's case, but that one is also quite narrowed, as you can see in the photograph. And I should probably back up and explain that when I say narrowed, I mean the yellow plaque that you see eccentrically lining those coronary arteries like a partially clogged plumbing pipe. That's the cholesterol, that's the fibrous tissue, that's the scar that you don't want in your coronary arteries. That's why your doctor checks your cholesterol and asks you not to smoke and tells you to watch your weight and your blood pressure. This is what he or she is trying to prevent, is that plaque buildup. That's the yellow discoloration you see in these arteries. They should be wide open. You should be seeing through a round hole in each of those, but they're pretty severely narrowed. So getting back to the description of the photograph, the fourth cross-section you see, which is more closer to the 1 on the scale, that's Mr. Floyd's right coronary artery. In most adults, that would be the second largest of the 3 coronaries. You can see that one is also significantly narrowed by atherosclerotic plaque as well.
So, Dr. Baker, are you kind of familiar with the concept of acute changes in plaque buildup?
Yes.
Would you tell the jurors what that means?
So there are times at autopsy when we can tell that a plaque has suddenly changed because it has fractured. These plaques can actually be kind of hard. That's why this is known as hardening of the coronary arteries. Sometimes these plaques will fracture and you can see clot or fibrin, which is protein from the blood, suddenly filling that plaque. And so the plaque went from being smaller than it used to be bigger than it used to be very, very quickly. Sometimes you can even get hemorrhage into a plaque as it fractures, and so the plaque can grow very quickly. We can see that with the naked eye at autopsy. Sometimes we can see that under the microscope as well. To get to the heart of your question, Counselor, I did not see those changes in Mr. Floyd's coronary arteries. These looked to me to be, I guess you would call them stable plaques, for lack of a better term.
And if they had fractured in some way and created a clot of some kind, would that be observable on autopsy?
Yes, and that's one of the reasons we dissect these arteries so carefully, is you wouldn't want to miss an acute change or a thrombus, because in most cases that would tell you a lot about how the person died.
And if there were a thrombus and it affected the heart muscle, what would that look like if you had such an affected heart muscle on autopsy?
If we find a thrombus, which means an acute clot in a coronary artery, if the person dies very, very quickly, which is entirely possible, we won't see anything abnormal in the heart muscle that depends on that coronary artery for its survival. People typically need to survive for hours from their acute cardiac event before we can see any changes in the heart, either under the microscope or with the naked eye. So again, if a person dies very, very quickly from a coronary artery event, we can only infer what happened based on the fact that they have bad coronaries and the circumstances of their death. We wouldn't expect the heart muscle to look abnormal.
And if the heart muscle does show damage from a clot, what does that look like?
So that depends on how long the clot has been there and how long the person has survived. There's a generally good progression of changes that we see very, very early. All you might see under the microscope is some of the heart cells start to look a little bit wavy and abnormal. Shortly after that, they start to take on way more pigment under the microscope than the surrounding heart cells do. They look much brighter to us under the microscope. Then those heart cells start to die, or necrose, as we say in pathology. That necrosis then brings in an inflammatory reaction from the body, and so you see inflammatory cells come and start to clean up those dead heart cells. And then eventually the body will bring in what we call granulation tissue, which is new blood vessels and early scar tissue. And if the person survives long enough, that dead area of heart will just turn into a scar. Dead heart cells, unfortunately, don't grow back, and so once they die, depending on how long the person survives, we'll see anything from those very early changes all the way out to a scar.
But with respect to Mr. Floyd, you didn't see any damage to the heart muscle?
That's correct.
Let's talk about the brain. Did you note any injury or damage to his brain tissues?
I did not. I did not notice any acute injury to his brain in the sense of physical trauma, nor did I note any injury to his brain in the sense of it being deprived of blood or oxygen.
Did you note anything regarding Mr. Floyd's lungs?
Mr. Floyd's lungs were quite edematous, meaning they had a lot of fluid and congestion in them. But other than that, they were generally normal postmortem lungs.
And is it possible to get fluid on the lungs, or edematous lungs, I think you called it, from the efforts to resuscitate Mr. Floyd after he was taken from the scene?
Yes.
And what kinds of fluids could cause that?
Well, basically what we're seeing at autopsy is just called edema fluid, which is a lightly protein-filled fluid that seeps out of the blood into the lungs and fills up the breathing spaces. We see that in people who have had protracted CPR, who've been given lots of fluid. As their heart's not working very well, perhaps not at all during the CPR, they're still getting a lot of fluid put in them in the emergency room, and so we can see that pulmonary edema from that. There's other circumstances in which we see pulmonary edema as well. It's a fairly non-specific finding.
And so in this instance, with respect to Mr. Floyd, you didn't need to take the time to try to understand what was the source of his pulmonary edema?
I don't know that I could pinpoint the source with any accuracy. Again, given that he got CPR, there's multiple potential explanations for his pulmonary edema.
What about the prospect of what's called a pulmonary embolism? What is a pulmonary embolism?
A pulmonary embolism is when you have a clot form in another part of your body. Most commonly it's in the lower legs or the pelvis, although it can form in other places. And that clot breaks off and it goes straight to the lungs, because that's where your heart pumps all the blood as it returns from your body. A massive pulmonary embolism can be almost instantaneously fatal, and by massive I mean it blocks the artery coming off the top of the heart that goes to the lungs. Smaller pulmonary emboli can go out into smaller branches of the lungs. Sometimes they're completely asymptomatic, sometimes they're symptomatic, sometimes they can be life-threatening if the person has underlying conditions. We do always look for pulmonary emboli as part of a forensic autopsy.
Did you see any pulmonary emboli in the case of Mr. George Floyd?
No, he did not have any pulmonary emboli.
Dr. Baker, let's talk about the toxicology. Did you seek what's called a toxicology screen in this case?
Yes.
Would you tell the jury what is a toxicology screen?
So we actually use the term expanded panel simply because the laboratory that we use, that's the terminology. But in essence, what we do is we send off one or more tubes of blood, and in some cases urine, to our toxicology lab, and they run a very comprehensive panel looking for a variety of illicit drugs as well as scores and scores of prescription drugs. I expect that you've probably already heard from a toxicologist, so I won't go into the laboratory part of it because that's not my area of expertise. But part of the testing they do is antibodies, looking for specific categories of drugs like morphine and related compounds, benzodiazepines, things in that class, barbiturates, and so on. And then the lab can do a variety of other techniques that are often go under names like gas chromatography, liquid chromatography, mass spectrometry, things like that. And they have the potential to detect hundreds of different medications that way. That's what we call the expanded panel with the lab that we work with, and that's typically what we ask for on most forensic autopsies.
And is the lab you work with NMS?
Correct.
How long have you worked with NMS labs?
It's been about 13 or 14 months now.
So for the past 13 or 14 months, would that be the only lab that you would be sending out toxicology panels or screens to from the Hennepin County Medical Examiner's Office?
Yes, all of our postmortem toxicology is done by NMS.
Are you familiar with a toxicologist named Dr. Eisenschmidt?
Yes, I know Dan.
Dr. Eisenschmidt testified here just, time flies, I don't know if it was yesterday or 2 days ago, but he testified here. Do you have a good opinion of him as a toxicologist?
He's been great to work with so far. We
Hold on. Objection is sustained.
Well, you know Dr. Eisenschmidt.
I do.
Did you examine the contents of Mr. Floyd's stomach as part of your autopsy?
I did.
What did you note regarding the contents?
Counselor, can I refer to my report so that I don't
Yes, if
misspeak?
it helps refresh your recollection.
I'm simply going to quote what I dictated as part of the postmortem exam. The stomach contains approximately 450 milliliters of dark brown fluid with innumerable soft fragments of gray-white food particulate matter resembling bread.
Did you note anything resembling either a pill or pill fragments in the stomach contents?
I did not.
Did you do any testing of the contents of Mr. Floyd's stomach as a part of the toxicology assessment for Mr. Floyd?
So I wouldn't do any testing of that. It is possible that we could send it to a lab like NMS for testing, but I did not request that.
So were you aware of whether or not Mr. Floyd had tested positive for COVID?
Yes, I was aware of that. Not at the time I did the autopsy, but I became aware of that later.
Was that significant to you in any way?
That he had tested positive for COVID?
Yes, sir.
I guess it kind of depends on what you mean by significant. This was very early in the pandemic, and we were still scrambling to figure out things like autopsy safety protocols and what we should be wearing. So in that sense, it was significant. In Mr. Floyd's specific case, the fact that he had been COVID positive 7 or 8 weeks before he passed away did not factor into my cause of death determination because I didn't see any signs of COVID at his autopsy, and his lungs did not have any of the stigmata of COVID that I would expect to see under the microscope.
So was he clinically symptomatic from your point of view?
I can't assess that because I didn't know Mr. Floyd when he was alive. To the best of my knowledge, he was generally healthy on May 25th before the events of that evening. I'm unaware that he was suffering from any acute COVID symptoms at that time.
You also know that Mr. Floyd had sickle cell trait. What can you tell us about that?
Sickle cell trait is carried by about 8% of Americans of African heritage. What it means is that one of the genes that codes for the beta chain of hemoglobin has an abnormal substitution in it. If you just have sickle cell trait, chances are you will go through life and never have any symptoms from it because you make plenty of normal hemoglobin. That's very different than sickle cell disease, which means that both of the genes have that gene substitution, and then you have sickle cell disease. People with sickle cell disease can get very severe anemia, they can have sickle cell crises, they're subject to a variety of infections and other complications. But Mr. Floyd didn't have that, he just had the one gene for sickle cell trait. I wouldn't even have known that, except that it happens that people who have sickle cell trait, when you take a biopsy of one of their tissues and put it in formaldehyde, which is what pathologists do with all tissue, the formaldehyde can cause cells to sickle as a postmortem artifact. And so when I saw that on Mr. Floyd's slides, I immediately called the hospital lab and I said, do you have a peripheral blood smear for Mr. Floyd? And it turned out they had made a blood smear during his CPR. And so I had a pathologist who specializes in blood disorders look at the slide and confirm there was no evidence that Mr. Floyd was sickling on his peripheral smear during life. I did also have our lab then run a sickle cell quantitation, which means they actually quantify the abnormal hemoglobin in the blood. And sure enough, that came back with the exact number that would be consistent with Mr. Floyd having sickle cell trait. So it's really just a fluke that it got picked up at autopsy. In my opinion, it doesn't have anything to do with why he died.
All right. What about paraganglioma, a kind of tumor? I'll just ask you about the paraganglioma as to whether you found or concluded that it had anything to do with Mr. Floyd's death.
So the short answer is I don't feel Mr. Floyd's paraganglioma had anything to do with his death. What we're talking about is an incidental tumor that I happened to find in his pelvis during the autopsy. I did look at it under the microscope. The most likely diagnosis is a paraganglioma, but I have no reason to believe that had anything to do with Mr. Floyd's death.
Okay. So Dr. Baker, want to switch and talk about the death certificate.
Okay.
So if we could pull up Exhibit 194. Well, first, I'd like to talk to you about the press release report.
Okay.
And ask you first, Dr. Baker, if you would just identify what this is for the record.
Yes, what you are looking at is the final press release my office put out once I had reached my conclusion as to the cause and manner of Mr. Floyd's death.
Okay. Can you explain to the jury what it means to certify a death?
To certify death as a physician means that you fill in the decedent's cause of death and their manner of death. And if their manner of death is other than natural, then you also have to fill in the how injury occurred box on the death certificate. Death certificates are relatively standard in the United States. Most of what's on them is largely dictated by the Centers for Disease Control. They vary a little bit in appearance from state to state, but the core elements are pretty much the same in every jurisdiction. Most of what's on a death certificate is actually filled in by family members and the funeral director. So, what's the decedent's full name? Where were they born? What are the names of their parents? Did they ever serve in the armed forces? There's all kinds of things that are captured. The medical examiner's primary role, again, as I mentioned, is the cause of death, the manner of death, and the how injury occurred. Most death certificates in the United States are actually filled out by clinicians, meaning your primary care doctor that you see. That person fills out death certificates for their patients who die of routine natural conditions. Medical examiners get involved when the death appears to be from unnatural causes. In practice, we should be the only people that certify deaths where the manner is ever anything other than natural.
So doctor, if we could look at Exhibit 193. First, would you, for the record, tell us what this is?
Yeah, this looks to be a actual state of Minnesota death certificate for Mr. George Floyd. These death certificates are actually produced by the state, not by the medical examiners. We simply fill in the parts we're responsible for. We push all of those data to the Minnesota Department of Health, and then the death certificate's issued by the state. And so that's why what you see here says state of Minnesota on the top. But the cause of death, the other contributing conditions, and the manner, that's what I'm responsible for, and that's right in the middle of your display.
Yeah, just want to zoom in on that and show it to the jury. I think this is pre-admitted, Your Honor. Okay. So if we look at the cause of death, immediate, underlying, other contributing conditions, this would be the section that you fill out then.
Correct.
So if we see here under manner of death, it indicates homicide. Tell us, what does homicide mean to you as a medical examiner?
So as a medical examiner, we apply the term homicide when the actions of other people were involved in an individual's death. It's one of 5 manners of death that we can choose from, the other 4 being accident, suicide, natural, or undetermined. Homicide in my world is a medical term. It's not a legal term. From a vital health and public statistics point of view, it's critical that medical examiners fill in a manner of death on every death certificate, because from a public health point of view, you want to know how many people committed suicide in your state, how many people died of accidents in a given year in your state. And so it's a key piece of public health data, but we don't use it as a legal term.
So we'll look at 918, correct? Dr. Baker, in front of you, Exhibit 918 is a list of manners of death, the ones you just talked to us about. Natural, accident, suicide, homicide, which I've highlighted because it's what you found in this instance, and then undetermined. Would you tell us from your point of view as a medical examiner, what does natural mean?
Natural means the person died exclusively of natural diseases.
Right, so an example of a natural disease might be a heart attack or a fatal arrhythmia as a primary cause of death.
Those are actually pretty vague terms. We're much more specific. So to your point, counselor, arteriosclerotic heart disease causing a heart attack would be a natural cause of death. A ruptured brain aneurysm from long-standing untreated high blood pressure would be a natural cause of death. Metastatic lung cancer would be a natural cause of death. There's almost an infinite number of potential natural causes of death.
And if we look at accident as an accidental cause of death, is a drug overdose an example of what could be an accidental cause of death?
Most drug overdoses are accidental causes of death. Some are suicides. But yes, we do regard most drug overdoses, because we don't believe the person intended to die, we do regard those as accidents.
Mm-hmm. And we know what suicide is. Doctor, what does undetermined mean?
Undetermined means that despite the best efforts of law enforcement, the medical examiner's investigators, we simply never could pin down the circumstances under which the individual died. In any good medical examiner's office, you are going to have a small percentage of cases every year that go out undetermined in manner. Most of those, as it happens, are people who died of drug toxicity, and based on the drug levels, based on the person's known history, we just don't have enough data to know whether this was a suicide or an accident. And so if we don't know their intent, it's often undetermined. More dramatic but slightly less common example, you find a skeletonized body out in the woods. You have no idea why the person was there, how long they were there. There's very little left to work with, so you don't really know what happened. A case like that might go out undetermined as well. Again, much less common, but undetermined essentially means we never really did figure out the circumstances.
Now, in Mr. Floyd's case, you listed the immediate cause of death as cardiopulmonary arrest, complicating law enforcement, subdual, restraint, and neck compression.
Correct.
What does cardiopulmonary arrest mean?
That's really just fancy medical lingo for the heart and the lungs stopped. The heart, no pulse, no breathing.
So with respect to the term complicating, am I right in the understanding that this term means occurring in the setting of?
Yes.
Or in other words, cardiopulmonary arrest occurring in the setting of law enforcement, subdual, restraint, and neck compression.
Correct.
So Dr. Baker, can you tell us how it is physiologically that the subdual, restraint, and neck compression caused Mr. Floyd's death?
In my opinion, the physiology of what was going on with Mr. Floyd on the evening of May 25th is, you've already seen the photographs of his coronary arteries, so that you know he had very severe underlying heart disease. I don't know that we specifically got to it, Counselor, but Mr. Floyd also had what we call hypertensive heart disease, meaning his heart weighed more than it should. So he has a heart that already needs more oxygen than a normal heart by virtue of its size, and it's limited in its ability to step up to provide more oxygen when there's demand because of the narrowing of his coronary arteries. Now, in the context of an altercation with other people that involves things like physical restraint, that involves things like being held to the ground, that involves things like the pain that you would incur from having your cheek up against the asphalt, an abrasion on your shoulder, those events are going to cause stress hormones to pour out into your body, specifically things like adrenaline. And what that adrenaline is going to do is it's going to ask your heart to beat faster. It's going to ask your body for more oxygen so that you can get through that altercation. And in my opinion, the law enforcement subdual, restraint, and the neck compression was just more than Mr. Floyd could take by virtue of those heart conditions.
So Dr. Baker, just a point of clarification that frankly occurs to me as you were talking. As a forensic pathologist, it's not part of what you do within the four corners of your job to try to calculate what Mr. Floyd's either lung volumes or oxygen reserves or that sort of thing would have been, is it?
I think what you're getting at, Counselor, is the sort of thing that I would defer to a pulmonologist. Those are obviously things we can't measure post-mortem in living people. Clearly those things are the purview of pulmonologists.
Right. So Dr. Baker, we did find from the toxicology amounts of fentanyl and methamphetamine in the results from the lab.
That is correct.
You didn't mention either fentanyl or meth in Mr. Floyd's system. You mentioned those, but you don't list either of them on the top line as causes of death. Why is that?
Well, the top line of the cause of death is really what you think is the most important thing that precipitated the death. Other things that you think played a role in the death but were not direct causes get relegated to what's known as the other significant conditions part of the death certificate. So the other significant conditions are things that played a role in the death but didn't directly cause the death. So, for example, Mr. Floyd's use of fentanyl did not cause the subdual or neck restraint. His heart disease did not cause the subdual or the neck restraint.
All right. So these are items that may have contributed but weren't the direct cause.
Correct.
No further questions, Dr. Bates.
Mr. Nelson. Sure. We're going to take a 10-minute break. Just a reminder, you're under oath still.
Yes, Your Honor.
Mr. Nelson.
Good afternoon, Dr. Baker.
Good afternoon, Mr. Nelson.
If I may have just a moment, Your Honor, to... So, Dr. Baker, thank you for being here with us this afternoon. Just some follow-up questions I kind of want to break up into two different sections. One about the autopsy and then some other questions about events after autopsy, okay?
Okay.
All right. So you understand, Dr. Baker, that you've testified in many cases in Hennepin County before?
Yes, I have.
Dakota, Scott County as well?
Not nearly as much, but yes.
And you understand that as a part of the process of exchanging information, the defense receives copies of everything, your reports, meeting notes, prior statements you've given, things of that nature,
Yes.
right? Okay. And have you had opportunities to review all of that information prior to your testimony today?
To the best of my knowledge, yes.
Okay. And ultimately what you testified is in a death investigation, it's much more than just simply an autopsy, agreed?
Correct.
And in fact, if you pull your file, it usually ends up being a few inches thick, right?
We're actually paperless at the medical examiner's office, but if you printed it out, yeah, I guess it would be a few inches thick.
Yeah. Well, that's what I did, and that's what it is. I guess I got to get with the times. But ultimately, that file contains your autopsy report, correct?
Correct.
Death certificate, the paperwork that you fill out for the state of Minnesota?
Yes, we don't actually get a copy of the death certificate from the state, but everything we put on the death certificate is in our file.
Right. And then you also keep track of conversations that you have with people, right?
Generally, yes. That's usually more my investigators who are talking to family, treating physicians, hospital records departments and stuff.
So you keep sort of a log, so to speak, of today investigator so-and-so spoke with X, right?
Again, I don't personally do that so much, but yes, my investigators do.
Right. And it's all a part of this file, right?
Correct.
And then in addition, you obtain any known medical records that may factor into your analysis as well, right?
Yes.
You had received some hospital records from HCMC regarding Mr. Floyd, correct?
Correct.
But you don't go out and try to search, or perhaps you do, try to search for every provider that he or that any person generally may have seen, right?
In most cases, that's correct, counselor. There wouldn't be a lot of point in us trying to get every medical record ever generated for a particular decedent. It would only be if I thought it would help me understand the cause and manner of death better.
Okay, fair enough. Now, I want to talk to you first about the word complicating. How do you define the word complicating as you used it as to the cause of Mr. Floyd's death?
I use the word complicating the way I think most physicians use the word complications, and I'm guessing that most people who've ever been a patient or had a loved one who's been a patient knows what physicians mean by the word complications. It means that an intervention occurred and there was an outcome that was untoward on the heels of that intervention. So for example, somebody goes into the hospital for hip surgery and they develop a blood clot in their leg. That's a complication. You get started on a new medication for a heart condition and you have an allergic reaction to it. That's a complication. So it's an untoward event on the heels of an intervention that happened. That's how I look at it as a physician.
Right. And it could be during an incident as a result of an incident, right?
Again, we don't usually use the word incident in medical practice, but yeah, it could be an immediate complication as a result of a medical intervention or therapy, or it could be what we call a delayed complication.
Right. And there are certain circumstances that precede those complications. Agreed?
That's a little vague, counselor. I wonder if you could...
Well, I mean, in any death investigation, you're trying to determine the cause and manner of death, right?
Correct.
And in this particular case, you obviously took into consideration the police restraint, right?
Correct.
But you also took into consideration the heart disease, correct?
Yes.
As well as the toxicology results. Agreed?
Yes.
And you factored those in your cause. There's the cause and manner of death, and then there's the second thing that you left blank, right? And then there's the contributing causes or contributing factors.
Yes, the term of art is other significant conditions is what you're getting at, Counselor.
Yeah. And that's simply just something you have to do for the CDC, or did you take those into consideration as contributing to Mr. Floyd's cause of death?
So when you put those on a death certificate as a physician, what you're saying is, I think these played some role in this death. They had a contributing condition. I'm unaware of how the CDC would mandate what goes on there. Presumably the goal is you put things on there that you believe are relevant. You don't list trivial stuff on there that didn't play a role.
And so if something was significant enough, you put it on, but if it's insignificant and didn't contribute, you leave it off.
Generally, yes.
Okay. And so in your opinion, both the heart disease as well as the history of hypertension and the drugs that were in his system played a role in Mr. Floyd's death?
In my opinion, yes.
All right. Now, again, in terms of your autopsy report, you don't generally note negative findings, right? If something is normal, you may just say it's normal, but you're not going to take special note to say the heart is completely, perfectly normal.
That's a really long question, Counselor, but I think I can give you a reasonable answer to that. For most normal organs, we have a boilerplate description for what that organ is. So if a spleen is normal, I'm going to give a normal description of the spleen with the weight of that spleen. The same for a liver. Depending on the nature of a particular case, there are, I used this term earlier, pertinent negatives, things that you think might be on the body based on the circumstances, so you specifically seek those things out, and if they're not there, you document them because the fact that they're not present really means something. So I don't know if that answered your question. There's some things that are normal, that they're almost always normal, and we go on to the next step of the autopsy. There's some things that, depending on the complexity of the case, the fact that it's not there, you're going to dwell on that, you're going to do a special dissection, you're going to take a picture, whatever you need to do to document that you specifically looked for something and it wasn't there.
Okay, and so in that regard, if you note something, whether it's odd or irregular, or it's the negative, right? You take special precaution to note those things in your autopsy.
Ideally, yes. Not only do you document that in your narrative report, but you take a picture of things that are there and you document things that aren't there that people might have expected to be there.
Okay. And it's interesting to me that you made a conscious decision not to watch any videos before you performed the autopsy, correct?
Correct.
And that was to prevent bias, you described?
In general, yes. I don't want to go into an autopsy with a preconceived notion that I already know what happened, because that might tempt you to skip certain steps or not do certain things that could turn out to be relevant. So, and just full disclosure, counsel, to fully answer the question, I did see the video that the entire world saw later that day after Mr. Floyd's autopsy. I did not release his body until the following morning. So had I seen something on the video that triggered yet another thought in my mind, I still had the chance to act on it. I did not want that to be in my mind when I physically performed his autopsy on the morning of the 26th.
Understood. But you had received some briefing from law enforcement or from somebody to say, here's generally what we know about what happened.
It was pretty high level, but yes, I got a phone call from the BCA that a man had gone unresponsive in police custody while he was being restrained. He had died at Hennepin County Medical Center, and that was largely what I knew going into the autopsy. I believe I was aware that there had been pressure applied to his neck, but beyond that, that's pretty much what I knew going into the autopsy.
So you took special, because you had learned that there was potential pressure to the neck, you took special steps to look at the neck area, shoulders, etc., right?
Yes.
And because of that, you did this unique incision or this specific incision to lift the skin off to look under the surface, so to speak.
That's correct.
All right, and we'll come back to that in a second. You did note, I want to focus on the heart for a little bit. You noted that the heart was dilated.
Yes.
What causes that?
So dilated is just fancy medical lingo for has gotten a little bit bigger than it used to be. Like when you blow up a balloon, it dilates, for lack of a better lay description. Mr. Floyd's heart was, if I can refer to my report, Counselor.
Refresh your recollection.
It would. So I described the ventricles, which are the two main pumping chambers of the heart, the right and left, as mildly dilated in Mr. Floyd's case. I would interpret that as being part and parcel of his high blood pressure. That's a manifestation of the heart getting bigger and heavier as it works against that continued high blood pressure over a period of time.
You also took note of the size of Mr. Floyd's heart, right?
It's actually the weight, Counselor, but yes,
Weight, yes.
absolutely did take note of the weight, yes.
All right, and that was 540 grams?
That is correct.
And you're familiar with the papers of DeMaio and Molina on the normal heart size?
I am familiar with DeMaio and Molina paper, although the one that I usually use is the Kitzman paper from the Mayo Clinic.
Okay. And what's the maximum size of a heart under that standard?
So the Kitzman paper normalizes heart weights as a function of your body length and your body weight. Because if you think about it, a very large person is going to have a larger heart than a very small person. So you don't want to penalize people for being too big or too small. That's why you normalize their heart weight. So in Mr. Floyd's case, the upper limit of normal for his body length, according to the reference that I use, is 510 grams. The upper limit of normal for his body weight would be 521 grams. Again, he was 540 grams, and so he is outside the upper limit of normal. That means on the bell-shaped distribution of heart weights for a man his size, he's way out on one of the tail ends, the heavy end.
Okay. And all of these various standards in terms of the weight of a heart, they're peer-reviewed?
As far as I know, yes. The reference I use is from the Mayo Clinic proceedings, which I'm going to assume is peer-reviewed.
Right. And as would be, say, DeMaio and Molina's or the Northwestern studies or any of these other studies?
I'm not familiar with the other studies you're referencing, Counselor. The DeMaio and Molina paper, I believe, was published in the American Journal of Forensic Medicine and Pathology, which I know to be peer-reviewed.
Okay. And you would agree that the larger the heart is, the more blood it needs to provide adequate oxygenation. Agreed?
As a general rule, I would say that is true, yes.
What types of things cause a person's heart to be bigger than normal?
The most common cause by far in adults in the developed world would be high blood pressure. There are a number of far less common causes. Aortic valve disease could do it if the heart's pumping against a defective valve. There are genetic causes of an enlarged heart. Typically, we can tell those by looking at the heart grossly and microscopically. Those are much farther down the list than high blood pressure, which again is the number one by a long shot.
And based on your review of Mr. Floyd's medical records, you determined that he has a history of high blood pressure, correct?
Yes, it was very helpful to learn that from his medical records. He was known to be hypertensive.
Can you describe the narrowing or the stenosis of the coronary arteries a little bit more detail?
I can, Counselor, if I may refer to my report again. So as I mentioned when I was describing the photographs earlier, he had 75% proximal and 75% mid narrowing of his left anterior descending coronary artery. Again, in most people, that would be the largest of the three coronary arteries. He had 75% narrowing of the first diagonal branch of his left anterior descending coronary artery. And then in his right coronary artery, which in most people is the second largest of the three, he had 90% proximal narrowing.
All right. And what do forensic pathologists generally consider to be enough narrowing of the arteries to cause a sudden death?
We usually look to 75% greater as capable of causing sudden death.
And are you familiar with myocyte necrosis?
Yes.
And do you have to have myocyte necrosis to cause a sudden death?
No, you do not.
In an arrhythmia, there would be no necrosis, correct?
So an arrhythmia is an electrical phenomenon, not an anatomic one, and so I really can never diagnose an arrhythmia post-mortem. We just have to infer that from the circumstances and from the condition of the coronaries.
And when we describe hypoxia of the heart, that's the reduction of oxygen to the heart, correct?
Correct.
And can you, can hypoxia to the heart cause sudden death by other means? Or would it just be the arrhythmia?
Well, there's many ways that a lack of oxygen to the heart could cause death. One could be a sudden dysrhythmia, where the person's heart goes from a normal beat to a non-perfusing beat, and the person would literally just collapse right in front of you. Depending on the nature of the coronary artery disease, a person could have a thrombus. They could present to the emergency room with crushing chest pain and sweating and difficulty breathing. That would be a different mechanism of death. So there's different ways the heart manifests that is not getting enough oxygen, but one of them is sudden collapse and death.
And sometimes people can survive that for a longer period of time.
Survive.
The thrombus you just described? I mean, like
Correct. I mean, I don't know the numbers, but obviously people can and do survive thrombi in their coronary arteries. That's why we have clot-busting drugs and cardiologists on call for emergency rooms for urgent catheterizations and stuff like that.
Gotcha. Now, can you generally describe the conduction system of the heart?
Only in the broadest terms, because I'm not an expert in the conduction system of the heart. I have other people I rely on for that, but it's basically the electrical system of the heart. There's a part of your heart called the sinoatrial node, and that's like the little watch in your heart that starts every heartbeat. You would be able to see what it's doing on an EKG if you were looking at an electrical tracing in a living person. That's then conducted to another node that's known as the AV node, the atrioventricular node, and then the electrical impulses go out from that to the ventricles that cause them to beat. You can actually see the conduction system under the microscope if you take it out and look for it. And there's on very rare occasions we do that. It wouldn't have been necessary in Mr. Floyd's case, but that's basically what the conduction system does.
If the conduction system is impaired, what happens?
I'd have to defer to a cardiologist on that because there's so many different ways it can be impaired. Sometimes it's completely benign. Sometimes a person might need a pacemaker or even a defibrillator. It totally depends on the nature of the derangement.
Which of the arteries supplies that first one, the SA node, the sino?
The sinoatrial node?
Right.
I believe it's a small branch of the right coronary artery in most people.
And is that the one that was 90% occluded?
Not the branch. I didn't dissect out the branch, but yes, the main right coronary artery was 90% narrowed.
You're aware also of the methamphetamine that was found in Mr. Floyd's system?
Yes.
Does methamphetamine further constrict the vessels and ventricles and arteries?
I don't know. I'm not an expert in the specific toxicology of methamphetamine. It is certainly hard on your heart in the sense that it does things like drive up the heart rate and drive up blood pressure. I don't know if it's a vasoconstrictor, but in either way, as a general rule for forensic pathology, methamphetamine is not good for a damaged heart, a heart with coronary artery disease.
Does the amount of the level of the toxicological findings affect whether it's good for the heart or bad for the heart?
I don't know that there's a scientific answer to that, Counselor, because I'm not aware that there's a quote-unquote safe level of methamphetamine.
And especially illicit methamphetamine, right? No safe level of the street drug versus the amphetamines that are sometimes prescribed.
Yeah, so I'm very unfamiliar with any medical use for methamphetamine in approved circumstances. I'm aware that amphetamine is used in some circumstances. That's definitely not my area of expertise. Again, my high-level overview as a forensic pathologist is all other things being equal, methamphetamine is not good if you have bad coronary arteries.
And exertion also causes the heart to work harder?
Correct.
And therefore would require more oxygen?
Correct.
More blood has to pump through to oxygenate the heart and send it to the rest of the body, right?
Correct.
And so in this particular case, we have Mr. Floyd's heart is at least above average size, right?
Correct.
He has a heart with narrowed coronary arteries, right?
He does.
There was evidence of a period of exertion prior to his being deceased.
Yes, I mean, we're getting outside the autopsy now, obviously, but it's clear from the videotapes that, yes, there was a period of exertion prior to him becoming unconscious.
So in terms of your investigation, you ultimately did watch the videos,
Correct.
including the body-worn cameras of the officers?
Yes.
And were you also provided with other videos in terms of surveillance videos, additional bystander videos, things of that nature?
I was.
And were you provided with investigative materials that what people said happened, etc.?
No, I did not have those.
Okay. Have you ever certified a death due to hypertensive cardiomegaly? I don't know how to cardio megaly. Megaly?
So the answer to that, Counselor, is yes. The term you're going for is hypertensive cardiomegaly, which is fancy medical lingo for the heart is too big because of high blood pressure. We don't typically use that term. We just use the term hypertensive cardiovascular disease because it's a little more precise. But yes, I have used that or similar terminology.
Have you ever certified a death due to atherosclerotic cardiovascular disease?
Yes.
And similar narrowings of the arteries compared to Mr. Floyd?
Yes.
In terms of the injuries to Mr. Floyd, the abrasions and things of that nature, obviously they appeared to be fresher to you. Would you agree with that?
They do appear to be fresh, but I want to be very careful in my answer. There's not any literature that allows you to date those kinds of injuries with any precision. Presumably there's contextual data that would allow us to know that Mr. Floyd didn't have those abrasions, an hour before he died or whatever. If you just showed me those abrasions blindly, could I tell you how old they are as a pathologist? And the answer is no, not with any precision.
Right. And in terms of the abrasions that we looked at on Mr. Floyd's body, they could have been from the period of time he was restrained on the ground, agreed?
Correct.
They could have also been consistent with the period of time where he was taken to the ground or brought to the ground, right?
Well, that would be true as long as there's something in his environment that would explain those abrasions. I mean, some of those would take a fairly rough surface to produce. A smooth surface you wouldn't really expect that to cause those.
Understood, but if you were in the midst of a struggle with police officers and the police officers brought Mr. Floyd to the ground, the moment of impact with the ground could have resulted in some of those abrasions.
Objection, Your Honor. It's beyond the scope and calling for speculation.
Overruled.
Would you mind repeating the question, Counselor?
Sure. Some of the abrasions that we looked at, it would also be likewise consistent with Mr. Floyd being taken out of a police car and put onto the ground.
Same objections beyond the scope of the autopsy. Overruled.
Yes, depending on how he made contact with the ground, if the direction of motion is correct and there's enough abrasive force, yes, that contact could explain those abrasions.
Okay. Would you agree with the general proposition that the prone position is not inherently dangerous?
As far as I know, based on my understanding of the medical literature, that is true.
Now, in terms of your autopsy reports, there's no, you dissected Mr. Floyd's shoulder and neck area, right?
That's correct.
And you found no bleeding into the subcutaneous tissues of the neck and back, right?
That is correct.
And there's no bleeding into the muscles of the back, correct?
That's correct.
And you don't have any section in your autopsy report to describe any injuries whatsoever to Mr. Floyd's neck and back like you do other areas of the report.
That's not true, counselor. There's a special paragraph that specifically describes me dissecting his back and not finding anything.
Okay. And you took pictures of that as well?
Correct.
And all of those procedures were documented in the normal course of how you, when you conduct an autopsy, right?
Yes, all of those things were photographed.
And you did that so that other people would have an opportunity to review your work, correct?
Correct.
And you understand that people have done that, right?
Yes.
Now, you have, I'm assuming, conducted many autopsies in your career?
I have.
If you had to venture a guess, how many autopsies have you conducted?
I've never kept a spreadsheet, but I would say it's probably in the neighborhood of 2,900 to 3,000.
Okay. You've done other autopsies where asphyxiation was the suspected cause of death?
Yes, asphyxia is a very common cause of death in my line of work.
Right. You see it manifest itself in many ways, right?
That's correct.
And there are certain things that you look for in the course of your autopsy to determine whether or not this death would be consistent with asphyxiation. Agreed?
Yes and no. It depends on the type of asphyxia you're talking about. There are many ways that human beings die of asphyxia. So as pathologists, we want to make sure we know the type of asphyxia that we're talking about, because the signs that you would see are going to vary from one type to another. And
including, you look at the brain for signs of lack of oxygen, right?
We do, but to be fair, the person has to survive the anoxic brain injury for a considerable period of time before we can see anything. In most of the asphyxias that we investigate, we're not going to see any acute changes in the brain.
You look for musculoskeletal changes to the body, right?
Again, depending on the nature of the asphyxia, yes.
So you may look for, perhaps if the asphyxia was from the front to the back, broken hyoid bones, for example?
Correct. We're specifically looking at things like the muscles of the neck, the thyroid cartilage, the hyoid bone, in things like strangulations and hangings where there's pressure on the neck.
Okay. And you formed some opinions ultimately about the amount of pressure and whether the pressure was applied to the neck, right?
Could you be more specific, counselor?
Well, ultimately you have your, you have described your cause of death, right?
Correct.
And part of your cause of death includes neck restraint, right?
I believe I actually used the term neck compression, but yes, that is on the top line of my cause of death statement.
And in the course of your many conversations that you've had with various prosecutors and law enforcement officers, you, after watching the video, you've made some statements about where you thought Mr. Chauvin's knee was placed. Would you agree with that?
Yes.
And did you feel that Mr. Chauvin's knee was compressing his neck?
Yes.
Did you describe it as being more on the back or in this lower part, base part of the neck?
So in my impression from the video, and I want to be very clear, I have no special expertise in looking at videos. I'm just looking at them as another person trying to figure out what happened. In my opinion, it would appear that Mr. Chauvin's knee was primarily on the back or the side or the area in between on Mr. Floyd's neck.
Did you see any evidence that he was occluding the carotid artery?
It did not appear to me on the video that his knee would have been able to occlude the carotid artery. Even if it were, normal people have two carotid arteries, and the unoccluded carotid artery would continue to supply blood to the brain.
And when you look at deaths by manual strangulation, for example, are you also looking for bruising?
Yes.
You're looking for bruising. Do you see that bruising in the majority of your cases or not in the majority of your cases?
Well, keep in mind that my patients are all deceased, and so if my patients were strangled, it was so significant that they died. And I say that because if you were to ask an ER doc for her experience looking at living strangulation victims, you might get a different answer. In my world, we typically see bruises on the outside of the neck, we see abrasions on the neck, we see bruises to the small muscles of the neck. Depending on the type of strangulation and how old the decedent was, we could even see fractures of the thyroid cartilage and the hyoid bone. And we often see petechiae as well, which are little tiny blood spots on the lining of the eyes. Sometimes you can see them on the face, on the inside of the lips, even the inside of the mouth.
And did you observe any of those signs in this case?
No, I did not.
And in terms of, you know, when you think about just kind of the classic strangulation, I'm taking my fingers and my hands and I'm applying pressure to your neck, even those small finger, you would expect to see bruises consistent with the size of my fingers, right?
Again, in my line of work, we more often than not see bruises. You did say consistent with the size of your fingers. That might be true on television shows, but in the real world, there's not a lot of correlation between the size of bruises we see and the size of assailants' hands. But we are looking for those telltale bruises.
All right. And in terms of, in this particular case, the knee, the placement of the knee being a pretty bony, hard, round object, right?
Yeah, I mean, it's pretty concentrated right under the kneecap at the fourth.
Right. And of course, the shin bone is just below the skin, right?
Yes.
And it's sort of triangular in its nature, right?
On cross-section, yes.
And so if a substantial amount of force was being used by the knee or the shin bone on the neck or back area in your line of work, and if that force was sufficient to asphyxiate him, would you expect to see bruising?
I would expect to see bruising, but I don't know that the lack of bruising excludes that. You and I kind of just pivoted from strangulation, which is really pressure to the front of the neck, to the pressure of the back of the neck. And that's just not something that I think we see as medical examiners, pressure to the back of the neck explaining a strangulation.
Or an asphyxiation.
Correct.
So is there any objective medical finding in your autopsy that shows a sufficient or significant amount of pressure to the back?
Again, I think we've covered this. I did not find any injuries to Mr. Floyd's back, not on the outside of his body, not looking at the soft tissue under his skin to make sure I didn't miss any occult bruises. I didn't find any bruises on his back.
Did you find any hypoxic changes to Mr. Floyd's brain?
I did not, but again, a person has to survive for many hours before we would be able to see those as pathologists.
You're generally familiar with a hypoxic death and how that occurs?
Again, counselor, it really depends on the nature of the asphyxia. Keeping in mind, in my world, asphyxia is hangings, it's strangulations, it's carbon monoxide poisoning, it's drownings. There's all different ways people can be asphyxiated. It really depends on which mechanism you're talking about.
Well, generally, regardless of the mechanism, would you generally see symptoms consistent with hypoxia? Would a person exhibit certain symptoms?
So symptoms is a little outside my bailiwick because we're talking about living people, and I don't treat living people who are suffering from hypoxia of any cause.
So, I mean, Dr. Thomas, who just testified, would testify that you may see confusion when someone is going into a hypoxic state.
Objection, Your Honor, to the characterization of Dr. Thomas's testimony.
Rephrases
Certainly.
what he agrees to.
So, your role as a medical examiner, right? You take into consideration information from lots of different sources.
That is true.
And there may be cases where you just don't know what's going on, right? You can't figure something out.
Could you be more specific?
Well, you have a decedent in your medical examining table, and there appears to be some sort of tropical disease, right? I'm assuming you're not a tropical disease or an infectious disease expert, right?
Certainly not an expert in tropical diseases. We do diagnose a lot of infectious diseases at the EM office.
But if there's some sort of infectious or tropical disease, you may go to another person and ask that person, hey, are you familiar with this?
Your Honor, object to the question in terms of relevance and beyond the scope.
Beyond the scope is overruled. Relevance at this point is sustained.
Sure. Do you rely on the expertise of other physicians when you conduct an autopsy?
Not always, but I am never above reaching out to clinical colleagues or other pathologists if they have an area of expertise that would help me.
And part of your job as a pathologist is to attempt to determine whether there is asphyxia in a particular case, right?
Again, it completely depends on the nature of the case, counselor, but if it appears to be an asphyxial death, we're always trying to get at the root of how did this occur? Why did this person asphyxiate?
And as a physician, you're physician and a forensic pathologist, you're familiar with what happens to the human body when someone asphyxiates, right?
In general, yes. Again, I don't actually see living people asphyxiate. I don't treat living victims of different types of asphyxia in a clinical setting.
But in the context of your research or education, you may go to a conference and they're saying, here's an asphyxia death. Let's talk about it, right? Here's a picture of someone hanging from all the way fully suspended versus someone who is on their knees and suspended forward with a belt or something.
Objective questions, vague and relevant, Your Honor.
Sustained is relevant.
Are you familiar with the symptoms of hypoxia?
Again, they would be very general symptoms, and I don't know what the differential diagnosis for those symptoms would be.
What would the general symptoms be?
Of hypoxia?
Right.
Probably some form of mental status change in the form of confusion or disorientation.
Incoherent speech?
Again, the differential diagnosis for something like that is so long. Could asphyxia explain that? Yes, but there are many other things that could as well.
When someone is hypoxic, does that cause that person to breathe faster?
I honestly don't know. Again, it probably depends on the nature of the asphyxia. I would defer any further questions to a pulmonologist because they're the experts in breathing.
Okay. Would you, based on your understanding, you reviewed the toxicology of Mr. Floyd, right?
Yes.
You'd agree that fentanyl is a respiratory depressant,
That's my understanding, yes.
that it slows breathing, resulting in lower oxygen levels,
It can, yes.
and similarly increasing the carbon dioxide, correct?
What it would do to carbon dioxide would be outside the scope of my expertise. I would defer that to a pulmonologist or maybe a toxicologist.
Methamphetamine is a stimulant, correct?
Correct.
Meaning, again, it causes the heart to beat faster,
Correct.
causes the heart to work harder,
Yes.
causes constriction of the arteries.
I believe you already asked me that, counselor, and my answer was I don't recall if that's a specific mechanism of methamphetamine, but I would acknowledge that it increases your heart rate and the work of the heart.
So, have you certified deaths by overdose?
Hundreds of times a year.
Have you certified deaths as an overdose where the level of fentanyl was similar to the level of fentanyl in Mr. Floyd?
Yes.
Have you done so where levels were lower
Yes.
or were higher?
Yes.
What's the lowest level of death by fentanyl overdose that you have certified?
Without doing a search of my office's records, I'm not prepared to give you an answer on that. I know I've seen levels as low as 3 nanograms per ml and possibly lower. Like all death investigations that we do, if it involves a drug overdose, you also want to try to piece together the person's history of how much they've been using it, how long they've been using it, if they're tolerant to it at all. There's a lot of variables that go into it, but I've seen levels as low as 3, in some cases even lower if there's other intoxicants on board, such as alcohol or benzodiazepines.
So the combination of drugs in any person's system is a relevant consideration.
I'm sorry, did you say irrelevant or of
Relevant, a relevant consideration.
Yes, combinations of drugs and interactions of drugs can be relevant.
And that's why you included both the heart condition of Mr. Floyd as well as his toxicology findings as other contributing issues to his death, correct?
That's correct.
All right. Now, I just want to kind of review with you the history of your involvement in this case, if that's okay.
Okay.
You obviously Mr. Floyd was deceased on May 25th of 2020, correct?
Correct.
You performed the autopsy on the 26th,
Yes.
and after the autopsy, you had a meeting with some Hennepin County attorneys, correct?
Correct.
On May 26th, correct?
Yes.
And do you recall telling them that the autopsy revealed no physical evidence that Mr. Floyd died of asphyxiation?
I don't know what my specific language is, but yes, that is what I conveyed to them, was the lack of anatomical findings that would support that conclusion.
All right. And you told them that you had avoided watching the videos at that point, right?
Until after I'd performed the autopsy, yes.
All right. Do you recall telling them certain factors that you thought contributed to the death?
Your Honor, object on the grounds of hearsay and cumulative.
Members of the jury, you should consider any statements made outside of court as possible impeachment of the witness's testimony and not for what is actually being asserted. Mr. Nelson, you may ask that question.
Thank you. Do you recall telling the Hennepin County Attorney's Office on May 26th, after you conducted your autopsy, what you thought the contributing factors were to his death?
I don't recall the specifics of that conversation. As far as I know, the only narrative record of that conversation would be what they wrote down. I would be shocked if I did not tell them about Mr. Floyd's heart condition, because obviously I knew that the moment the autopsy was done. I couldn't have known the toxicology results the afternoon of the autopsy because I wouldn't have those back for several more days.
So you found initially that his heart condition was pretty significant, right?
Yes, you would know that walking out of the autopsy suite.
You received the toxicology on June 1st of 2020?
Could I refer to my record and see if that's correct?
Yes. On or about June 1st?
That is correct. And I'm going off the toxicology report itself. It appears that it was issued on the morning of June 1st at 7:04.
Okay. Do you recall having a conversation with Hennepin County prosecutors about the significance of the toxicology findings?
I recall having the conversation. I don't recall the specifics of it, but I'm certain that I would have relayed the toxicology findings to them.
Do you recall describing the level of fentanyl as a fatal level of fentanyl?
I recall describing it in other circumstances. It would be a fatal level, yes, in other circumstances.
And would you agree that one of the causes of the pulmonary edema that you communicated to the county attorneys was also fentanyl?
Fentanyl can certainly be a cause of pulmonary edema. As I indicated earlier in previous questioning, it's confounded by the fact that Mr. Floyd had quite a bit of CPR, and so I find the pulmonary edema much less specific, given that he survived and made it to the hospital for a period of time.
Do you recall telling the county attorney's office that had you found Mr. Floyd under different circumstances, you would have determined this to be a fentanyl overdose?
So I don't recall specifically what I told the county attorney, but it almost certainly went something like this. Had Mr. Floyd been home alone in his locked residence with no evidence of trauma, and the only autopsy finding was that fentanyl level, then yes, I would certify his death as due to fentanyl toxicity. Again, interpretation of drug concentrations is very context dependent.
You then were also interviewed by the Federal Bureau of Investigation on or about July 8th of 2020?
I believe it was the Federal Bureau of Investigation and/or the U.S. Attorney. A lot of these took place over video calls, and I wasn't entirely sure who was who at all times, but I believe it was those two groups, yes.
And that occurred on July 8th of 2020, correct?
To the best of my recollection, yes.
Right. Were you asked but-for type questions?
I was.
And were you able to form an opinion on but-for the involvement of law officers, whether Mr. Floyd would have died under these circumstances?
Objection, Your Honor, is stated legal standard.
Overruled, this is not the legal standard, simply his diagnosis. You can go forward on that basis.
So I'll answer the question, Counselor. As I mentioned earlier, there were multiple people on these video calls, and at some point there was more than one person asking questions at a time. I don't normally think of things in the but-for paradigm. Perhaps that's a legal thing, but it's not normally how I think as a forensic pathologist. So what I clarified for the U.S. Attorney and the Federal Bureau of Investigation was my opinion as to what happened to Mr. Floyd, and that is he experienced a cardiopulmonary arrest in the context of law enforcement subdual, restraint, and neck compression. It was the stress of that interaction that tipped him over the edge, given his underlying heart disease and his toxicological status. That was also clarified in a letter from the Hennepin County Attorney to the U.S. Attorney, I want to say within a few days of that meeting, because of the confusion around how that meeting was run and the way those questions were asked.
Fair enough. Thank you. Again, the labeling this death as a homicide, that is a medical determination that you made, correct?
Correct.
It is not the same standard as the legal standard. Agreed?
I don't even know what the legal standard is, but they are two different worlds.
Now, in terms of your, again, involvement in this case, you have actually testified twice in connection with other proceedings, right?
Yes.
Regarding the death of Mr. Floyd, right?
Yes.
And the first of those testimonies occurred 20th of August, 2020?
Yes.
You understand that those were transcribed and under oath, correct?
Correct.
And you have had an opportunity to review those transcripts?
I have.
All right. The first time you testified in connection with the death of Mr. Floyd, at any point do you recall saying that I have to defer to some other specialty?
I believe I said that multiple times.
The first time you testified or the second time you testified?
I recall it was much more frequent the second time. I don't recall how often it happened the first time, if at all.
In terms of the placement of Mr. Chauvin's knee, would that explain anatomically why Mr. Floyd, would that anatomically cut off Mr. Floyd's airway?
In my opinion, it would not.
Did you testify extensively about the significance of the coronary arteries and the heart disease?
I'm not sure what you mean by the word extensively, Counselor. If we need to pull out the transcript, we can. I'm not sure what the word extensively means in this context.
Okay. You talked about the issues surrounding Mr. Floyd's death involving his coronary arteries, right?
Again, I can't quote you the grand jury transcript, but if you'd like to pull it out, I'd be happy to refresh my memory.
Sure.
I'm almost certain it had to have come up.
May I approach the witness, Your Honor,
For what purpose?
to refresh his recollection as he requested?
Let's lay the foundation for refreshing first.
In this proceeding, did you testify about, do you recall testifying about how the coronary arteries work relevant to providing the heart with blood?
I'm almost certain that I would have. I can't imagine that I didn't, but I don't recall how extensively that took place without looking at the transcript again.
Would looking at the transcript refresh your recollection about your testimony in that connection? In
Sure.
connection with it? May I approach? Dates 44314. Page 20.
What date?
26.
No, it's in the offer.
It does.
So what was the problem with the coronary arteries in this context?
I believe it's essentially the same answer I gave the jury earlier, which is because of the degree of narrowing of Mr. Floyd's coronary arteries, they have a limited ability to supply extra blood and oxygen to his heart muscle when he needs it. On top of that, he's got a larger heart than a man his stature would normally have because he's hypertensive, and so that heart is going to need more oxygen, which those coronaries have a limited ability to deliver.
And how do you think the introduction of methamphetamine to that scenario impacts?
Again, I can only give that a high-level answer as a forensic pathologist. I don't treat living people who have methamphetamine toxicity, but my understanding is methamphetamine is hard on the heart. It is going to increase heart rate. It's going to increase the work of the heart because it's a stimulant.
And in the circumstances of this particular case, in terms of a person with an enlarged heart, narrowing of the arteries, right? And how does the introduction of methamphetamine affect that?
And as I just said, it increases the heart rate, it increases the work of the heart. It's not something that I, as a forensic pathologist, would want to see in the blood of someone that has heart disease.
Did you describe it as a multifactorial process, the death of Mr. Floyd?
That certainly sounds like something I would have said, yes.
Okay. And then you testified a second time, correct?
To the federal grand jury?
Yes.
Yes, I did.
And that was in February of 2021?
Yes.
And ultimately, you deferred to experts far more extensively in that second testimony than the first, correct?
So the short answer to that is yes. The long answer is I believe I deferred to a pulmonologist repeatedly because there were so many questions about things like gradations of chest wall movement and would this, that, or the other thing impair a person's ability to breathe. And at some point, I clearly said, look, this is outside the scope of my expertise as a forensic pathologist. I think a pulmonologist would be better equipped to answer that question. I'm going to say I said the word pulmonologist at least a half dozen times in that testimony.
Do you recall deferring also to emergency medical doctors?
Again, it would depend on the context of the question, but I know I did reference emergency medicine doctors because some of the questions were like, when do you think Mr. Floyd really died?
How about cardiologists?
Yes, if the question was specific to an area that would clearly be a cardiologist's expertise, I'm quite sure I would have referred to them as well.
Thank you, Your Honor. I have nothing further.
Mr. Blackwell.
Dr. Baker, I'm going to be brief. So if we could look up, Brett, the section on cause of death. So, Dr. Baker, take into account the entire exchange you had with Mr. Nelson on Mr. Floyd's medical conditions, on whatever testimony you gave, wherever you gave it. I want to bring our attention back to what's reflected in Exhibit 193. And taking all of that into account, what today remains your opinion as to the cause of death for Mr. Floyd?
So my opinion remains unchanged. It's what I put on the death certificate last June. That's cardiopulmonary arrest complicating law enforcement subdual restraint and neck compression. That was my top line then. It would stay my top line now.
And so if we look at the other contributing conditions, those other contributing conditions are not conditions that you consider direct causes. Is that true?
They are not direct causes of Mr. Floyd's death, that's true. They're contributing causes.
And in terms of manner of death, you found then, and do you stand by today, that the manner of death for Mr. Floyd was, as you would call it, homicide?
Yes, I would still classify it as a homicide today.
Thank you, Dr. Baker. No further questions.
Anything further? Counsel, you sidebar